Good afternoon, everybody. Here with Josh and Paul and Deirdre. I tried to get our Commissioner of Education, Miguel Cardona, but he was pretty busy today. You probably just saw that President-elect Biden introduced him as our next Secretary of Education for the United States of America. And I could not have been more proud of Connecticut and our outgoing commissioner. The President-elect said how important it is for him that we get our schools open, that this not be a lost year for kids, and saluted Connecticut and Miguel for his partnership with educators and the fact that we were able to keep more of our schools open. He emphasized that in other states, kids are falling behind because they don't have access to Wi-Fi. And he used the analogy of some of the young people have to drive to the parking lot of their coffee shop in order to get access to Wi-Fi so they can virtually learn. And he saluted Miguel Cardona for saying, look, here in Connecticut, they provided 140,000 laptops for all the kids in need and provided free Wi-Fi for those as needed as well. And he wanted to use that as an example for what we can do around the country. He emphasized the really great importance of counselors and aides and social workers in our schools to help our kids get reintegrated. And he saluted Miguel Cardona for taking the lead on that here in Connecticut. And he emphasized, as did Miguel, workforce, that it's not K through 12 education. We're also training people for the jobs that are out there, making sure that this education that leads to a good paying job and a great citizen. And they saluted Miguel Cardona for the work he was able to do on that here in Connecticut now on behalf of kids all across the country. And Miguel did us proud when he pointed out that how important public education is. It's been his life, as he called it, the great equalizer. He was principal at the school where he was a student. He was principal of the year, and he saluted education as the great equalizer, as American as apple pie and rice and beans. That's what Miguel Cardona said, and Miguel, congratulations. We're so proud of you, and the people of the United States of America, the kids and parents and educators are lucky to have you there. We'll miss you, but let's stay in touch. Let's do a little bit on COVID, just to give you an update. 6.08% positivity. Sort of flat, that's what it's been for the last week. That's what it's more or less been since the post-Thanksgiving surge. Hospitalizations down a little bit, 1,155 COVID-related in our ICUs in our hospitals. That's about the same place we've been for the last month or so. Fatalities, tragically, up 32. I think this tells us, at least it tells me, I'm always trying to find themes that we did have a little poke up after Thanksgiving. It wasn't unexpected. We knew that there was a lot of travel going on, and things have calmed down and stabilized. But we are coming into a couple of days, Christmas, New Year's, worried about what that could be. So, yet again, I'm urging you caution. A lot of people flying in and out. It's very important that you, try not to fly unless you absolutely have to, and if you do, test and quarantine so that we can make sure we're on the backside of December holidays and we can do this safely going forward. And no need for additional restrictions or anything. I think we found that we've got some stability right now, but the most important thing we do is have you stay close to home. If you look around the country, you can see those places that stirred up the most in and around Thanksgiving were the places where there was the most mobility, most people traveling, most people flying in and out. And let's not let that happen to our region and our state. Vaccine update, 16,000 plus doses administered. You may say, hey, I thought we got twice as many as that. That's true. That's how many we've administered in the hospitals. We're still getting the numbers from the nursing homes. We hope that by the end of this week, all the third of the nursing homes will have received their first vaccination. And probably by the end of next week, it's closer to 2/3. I think you're finding that we've vaccinated as many people per capita as any state in the country. And for that, I'm really proud. And in particular, as we prioritize our healthcare frontline responders who are every day going out and keeping us safe and taking care of us as needed. 76 locations now are administering the vaccines to healthcare workers, greatly expanded. Pfizer has gotten agreement with Operation Warp Speed, that's OWS, to double supply. We haven't quite been able to figure out when that doubling of supply will be allocated our way, probably not till later in the winter or early spring, but that means we'll be able to accelerate the continuing vaccinations for Phase 1B and Phase 1C. As you know, that's the group of the frontline responders, and then 1C is, folks 65 and older and a broader cohort there. And by being able to accelerate the Pfizer vaccines, if we get more of that, we'll be able to accelerate that group. And Deirdre's advisory group is going to be meeting again next week. No rest for the weary as we finalize what those allocations are in close consultation with the CDC. I just want to say it's been exactly 1 month since we talked about the necessity of having people step up, we're in relatively good shape when it comes to testing. We're in relatively good shape when it comes to hospital beds. So far, so good on vaccinations. The place where we're most stressed, we thought, was in terms of people and the exhaustion factor, and I've heard that from everybody. And one thing we could do was we created a program, we call it Connecticut Steps Up, ct.gov/StepUpConnecticut. And thank you, you have stepped up. We have over 1,000 substitute teachers who have stepped up, able to help as apprentice teachers in the classroom, before this holiday break and when we get our kids back again in the middle of January. So those teachers who are quarantined or older should stay home. At least we have those apprentice teachers in the classroom. 400 plus temporary nurses aides, many coming out of retirement to step up and help relieve some of the stress and pressure we have at our hospitals and nursing homes. Over 300 medical volunteers who are there helping out with vaccinations and tracking administratively, make sure we get that right and what we've got to do. And that's the same with the 300 plus non-medical volunteers. We need you more than ever. The number of people in stress, number of people at Rensselaer lined up getting their food distribution in many cases. Thank you. Thank you on behalf of all the people at Connecticut. ct.gov/StepUpConnecticut. There's room for all of you, and we're trying to make it possible so we can relieve the pressure and stress as we get through. I hope we're bending the corner on this pandemic, and time will tell over the next few weeks and few months. Step up now. We could use your help. Guess I'll go with this. Time to shop local. I said I'm a pretty lousy shopper, and my kids always think I buy them stuff from the discard bin at the last moment on sale, and there's some truth to that. And many of the stores gave me some really good advice. Hundreds of you gave me good advice on places to go, and I've started that. I'm shopping local. I want you to shop local. What a difference it makes. You don't have to worry about delivery. Here it is. You've got about 24 hours to do it. And maybe I'll see you at Hartford Prince or High Nine Brewing or She-La-La in New Canaan, Greenwich. I know Shana now. Anyway, that's where I'm going to be later this afternoon. With that, Josh, Paul, Deirdre, here to take your questions, and a special shout out to our friend Miguel Cardona.
Channel 3 Eyewitness News.
Good afternoon, Governor. How concerned are you with the holiday season approaching? We saw the aftermath of Thanksgiving and how that with people traveling, and especially now we have Christmas and we have New Year's. My gym told me this morning, she said she was getting on a plane to go to Florida. You have a lot of elderly people who have homes in Florida who, will be traveling. So how concerned are you about that?
I'm concerned. Look, we've seen states with big flare-ups that have relatively restrictions, and a lot of the correlation is regarded people who are traveling, and a lot of it is related to those social gatherings that are happening. So I'm scared. You're going to go down to Fort Lauderdale. Maybe you have a little party on New Year's Eve. Then you fly back, and pretty soon you're going back to high school or something like that. That's a real risk. So I'm urging with every bone in my body to ask people to be cautious a little bit longer. That's how we get through this.
And I think a lot of people are looking forward in the sense that the stimulus, it looks like will pass, and that will bring some much needed financial and economic relief. And many people are anxious for the vaccine. And I know it's rolling out already in Connecticut, but it could be a while before people in Connecticut get it. And there are still people who are hesitant to get it. And in the meantime, people are not going to go out and go to restaurants. So I'm not sure what the answer is. Do you have one?
Look, I think things are going to quiet down for the next 2 or 3 weeks. I think people will be closer to home just because it's after the Christmas break, and I think that's probably a good thing. But also, my heart goes out to our small businesses, our restaurants, and others. That's why we got David Lamont. We're putting in place this bridge loan, or it's actually a grant program. And I hope that's a bridge to what's going on with the federal PPP support, which is in effect a grant, a lot bigger grant. I know there's some potential hiccups coming out of the White House and threats of vetoes. Don't do that. Don't do that in this holiday season. We really need you to be steady and give our small businesses this opportunity. And in the meantime, for those of you, support your small business. Maybe it's just pick up at that restaurant, play it safe, but they need your support.
Thank you, Governor. If I don't get a chance to see you or talk to you before, I wish you a happy holiday. You too, Josh, Paul, Deirdre, and even you, Jody Latina. I see you sitting there. So happy holidays, all of you, and stay healthy and safe.
Back at you.
NBC Connecticut.
Sorry, trying to unmute. Thank you for your patience. Good afternoon, Governor. Following up on Miguel Cardona's appointment to the Secretary of Education, obviously a big celebration for him here in the state, but at the same time, as you alluded to yesterday, it kind of leaves a void in that position here in the state. In the interim, how will that position be filled? And moving forward, what will the process be like to permanently fill that position?
Why don't you take that, Paul?
Yeah, thanks, Governor, and thanks for the question, Mike. In the interim, we'll be identifying and looking for an internal candidate within the department. So we'll have more details and news on that in the coming days. As is installed in statute, the State Board of Education plays a big part as it deals with identifying who will be the next Commissioner of Education. So we will be working with the State Board of Education once we get official word from Dr. Miguel Cardona on his last day and working with this administration. But overall, we're going to have to work closely with the State Board of Education and follow the process that's currently installed in statute. But at the end of the day, whoever comes out of that process, it's important that that individual is in close alignment with the governor's vision for the state of Connecticut on education. And they're going to have to follow, as the governor says, some big footsteps as it deals with Miguel Cardona. But we feel that there's probably, and there will be, vast interest in the position, not only within the state of Connecticut, but also nationally. So we look forward to starting that process with the Board of Education going forward.
And just as a follow-up, Mr. Governor, as Paul alluded to, it would have to be in line with your vision. How would you describe your vision, and what types of challenges do you think the next commissioner will face in this role?
I want to follow on what Miguel's been doing for the last 2 years, making education an absolute emphasis, broadening the base. I heard Vice President or President-elect Biden talk about, pre-K for everybody. I think workforce development so that high school leads into workforce, works into a job, making community college more affordable for everybody. Just the same things you heard the president-elect say why he chose Miguel Cardona. We have a lot of work to do on that. We're just getting started. And here we are still with this pandemic. We have a number of kids who have lost 8 months, doing what we can so they can continue their education virtually or in the classroom. So this is not a lost year.
Thank you, gentlemen. Happy holidays.
Happy holidays to you.
News 8.
Good afternoon, Governor. I'm
Jody.
wondering, do we have any indication of what kinds of education dollars may be coming from this next round of relief, and what might it go toward? Are there still needs across the state?
Yeah, we are going over that pretty diligently right now, but it could be in the hundreds of millions of dollars. And we're going to really prioritize in terms of public health. That's where the prime focus of these dollars is. What we need to do for testing. Actually, Josh is thinking about priority testing for our teachers when they come back to give them confidence. Make sure as we roll out the vaccines, the teachers are included in one of the earliest groups. Make sure we have the Binax testing in the classrooms for anybody who may be showing some symptoms. So those will be some of the priorities we have as we use our education dollars. And you didn't refer to it, or maybe you did, but it's also money for higher ed as well. And there they've gotten hit pretty hard, as you know, in terms of residents and dining. It's hit their revenues. So what we're going to do is everything we can in terms of public health to make sure those are costs that they don't have to assume.
Thank you, I appreciate it. Merry Christmas.
Merry Christmas to you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, New York City is sending sheriff's deputies to homes and hotel rooms of all travelers that are coming from the UK to make sure that they're complying with the city's 2-week quarantine requirement. Is Connecticut notified about whether any of these travelers from the UK are coming to the state? And are there plans to have Connecticut authorities? If so, check in on them.
Well, I think I'm going to pass that to Josh, but I can tell you I am glad that Andrew Cuomo is being strict and Phil Murphy is being strict if the same is going on in New Jersey. I'm glad that they're at least enforcing the testing protocols, so you test before you get on that plane. There's a highly contagious form of the virus in Britain, and there's no need. We found last time how travel could accelerate the spread, so I hope they're being cautious. Josh, anything on that?
No, nothing else to add. We're not sending police to people's homes or hotel rooms.
No.
But are we ever notified that, say, a traveler coming from the UK, their final destination is Connecticut?
We know everybody coming into Bradley Airport, but generally we're not notified of people flying in via another airport, no.
Governor, if I could add, our travel advisory does require individuals coming into Connecticut to complete the travel advisory form and to submit the results of their negative test to the Department of Public Health if they choose not to follow the quarantine requirement.
Okay, thank you. And have there been any problems with the temperature trackers on the vaccine shipments? We have a report about 14,800 Moderna doses in California that are going to have to be replaced because they had a problem with the temperature trackers.
We have had no such reports.
And one other, thanks. And another thing was we're reporting that Tennessee actually got an unexpected shipment of about 40,000 additional doses. Has Connecticut lucked out like that?
Well, Connecticut got a large dose shipment of Moderna this week, 60,000 doses for the first week. So nothing in addition to that large order that we were already expecting.
So nothing unexpected then?
Correct.
Okay. Great. Thank you very much, and happy holidays, everyone.
Thanks, Sue.
The Day of New London.
Thanks. This is Julia Bergman with The Day. My questions are for Commissioner Gifford. I talked to two of the directors at our local health districts today, and they mentioned that DPH notified them about a week ago that they are going to be asked to provide vaccinations during phase 1A, when initially they had told they were going to get involved in maybe 1B or later. What was the reason for bumping them up?
Well, we've been working with our local health districts all throughout the summer to get them enrolled as vaccine providers. And the role that we're asking them to play in 1A is not necessarily new, but we're asking them to become involved with two things. One is working with emergency providers and first responders that are medical first responders, and also to help out with the community providers who are not affiliated with a hospital system whether it's a doctor's office, a dentist's office, et cetera, who might be able to get a vaccine either through a health system or through the local health department. So those are the two roles that they'll be playing earlier on.
Thank you. And then my other question was that Governor Cuomo announced today that many of the Moderna vaccine vials actually hold an extra dose, and that I know that was the case with the Pfizer vaccine vials too. Are we finding that to be the case here in Connecticut with the doses that we've received so far?
You know, as you mentioned, that was the case with Pfizer. The vials have been somewhat overfilled, is our understanding. So I won't be surprised if we start hearing that from Moderna, but we don't have confirmation of that yet in Connecticut.
Thank you.
CT News Junkie.
Thanks, Max. Governor, given the spike in cases we saw after Thanksgiving, what are we sort of doing to prepare for the aftermath of Christmas and New Year's?
Yeah, well, Hugh, as you know, we've, I just gave you a slide on the Step Up Connecticut, the number of people we have as standby. As you know, we've created a couple of field hospitals, so we have some extra capacity there as well. And, but really, it's those informal social actions and your behavior that'll determine whether we can get through this with a relatively flat curve or something that's steeper and more surge-like. I hope it's the former. I think we can do it carefully.
Okay. Do we expect that this might actually be a worse or more severe increase than last month?
I've looked at the flight information. It does appear that people are doing more flying in and out of the region, in and out of the, within the 50 states than happened over Thanksgiving. So that can be a worry.
Gotcha. It's been about a month since you guys did the executive order for that $10,000 fine. Do you know if anyone's been actually fined for that yet?
I don't believe so.
All right. One other thing, I was wondering if you wanted...
But I'm glad it got your attention.
It did, yeah. If you might react to the president, it doesn't seem clear. He's sort of threatening maybe to reject this coronavirus relief package passed by Congress. What's your reaction to that posturing?
I think that type of erratic behavior is really dangerous right now. And it took Congress quite a while to come up on a very bipartisan basis, a relief package that really emphasizes public health in terms of aid, in terms of vaccinations, in terms of what we do for testing. It made a big difference for those small businesses. Look, I come out of small business. You need to be able to count and plan for things a little bit going forward. It made a big difference in terms of what we're planning for education coming forward. You just heard that question. So, where were you, Mr. President? They've been negotiating this for the last month. Don't come in after the fact and pull the rug out from under. It's really dangerous.
All right, I appreciate it. And have a good holiday, everybody.
You too, Hugh.
Connecticut Public Media.
Good afternoon, happy holidays. Is there any talk with Eversource and other utility companies about this upcoming Christmas Day storm that looks like it could cause a power outage or two?
Do you know about that, Josh or Paul?
Yeah, I'll jump in and then Josh can jump in. Yes, we've been in contact with both United Illuminating as well as with Eversource, our emergency operations center led by Commissioner Ravella, Director Hackett, and our deputy commissioner have been watching this very closely. We were going to be making some decisions later on this afternoon on whether or not we have an additional activation of our emergency operations center based upon our latest forecast that we should be getting in from Doug Glowacki and the team over there shortly. So it's a long way. Yes, we've been very much watching this and watching it very closely, and we'll be providing you all as well as others updates along the way.
Hearst, Connecticut Media. The Hartford Courant.
Hi, everyone. I'm just wondering, Governor, you've talked a lot about being careful around the holidays and, the potential for a surge that results from travel or gatherings. Are there specific guidelines about what people should and shouldn't do? Like, is the advice to only celebrate Christmas with people in your household, or can you have a few people over as long as it's fewer than 10? No travel at all, limited travel? Like, what specifically are the guidelines that people should be following?
Yeah, Alex, I'll tell you what I'm doing. I'm having a Christmas with just my immediate family, and that's my strong advice and guideline to each and every one of you. You've got grandma and grandpa around, and you've always celebrated with them. Put it off this year. Show them how to use Zoom. Tell them once you get that second vaccination, you'll be able to have a really good Christmas or holiday break in a couple of months. I urge people to stay close to their homes as best they can. Go out for essential reasons. Take a long walk outside. I think if we really are strict now, we're going to have real benefits, early this spring.
So when we talk about immediate family, are you talking about people who live in your household or people who you see regularly, or how is somebody supposed to know who's in their immediate family?
I would urge you to use your judgment. In my case, I got one wife, 3 kids, and a would-be son-in-law, so that will be my immediate family.
Mm-hmm. Dr. Gifford, do you have any similar advice about what people should be doing?
Yes, if I could build on what the governor said, the safest thing is to do as he described, which is limit the gatherings around Christmas and New Year's and other holidays to the smallest possible group close to your household. I'd also like to say, as the governor mentioned, we know that many people are traveling. And so if you are going to be joining someone outside your household for the holidays, wear a mask even when you're indoors, and keep your distance when you take the mask off. If you're joining someone for a meal that's not as part of your household, the physical distance and opening the windows and if the weather is permitting to be outside, all of those things are going to help lower risk. So keep that mask on even indoors, and make sure there's good ventilation and air circulation indoors if you're with individuals that aren't in your household.
All right, thank you, everybody. Happy holidays.
The Connecticut Mirror.
As the vaccines are rolled out, inevitably you're going to get complaints about how healthcare systems are prioritizing things, whether there's office staff who's getting something ahead of a doctor. So what is the role of the state in making sure that everybody adheres to the protocols and priorities?
You want that, Deirdre?
Sure. So we have shared some additional guidance with healthcare providers on how to think about rolling this out in phase 1A. You're correct that right now we don't have this week enough vaccine to vaccinate every single healthcare worker, nor do we have enough appointments. So there is going to have to be a little bit of an order. And what we've asked healthcare providers to think about is who is at highest risk of being exposed to an individual with COVID. And so those frontline workers, maybe in the ER or the ICU, that are at the highest risk, and then think about next lowest risk, and then the third lowest risk might be those with intermittent patient contact. And so there is going to be, all throughout this process, some patience required on the part of everybody who's part of a group, because we won't be able to vaccinate everyone in that group on the first day, obviously, of that next phase. So we're asking people to prioritize based upon risk. We're asking employers of healthcare employees to sign them up in a priority order based on their risk of exposure to COVID.
Are you getting any complaints yet?
I wouldn't say complaints. We're getting a lot of questions, and our team at DPH is working really hard to respond to them quickly. But no, we haven't had a lot of complaints about the order in which people are receiving vaccines.
And you talk about the outreach to the local health officials. So what is what's the advice you could give to physicians and other health workers that are not attached to a larger healthcare system as to when they can expect to be vaccinated?
Well, we sent out emails this week to a large number of employers asking them to get their employees signed up for appointments. So each employer that's not part of a healthcare system should designate what's called an employer coordinator. And that person is responsible for making sure that the employees in that office or dentist's office or clinic are uploaded into our system, and then each one will get an email. If you're a healthcare provider that works independently, but you qualify for 1A, you can sign up as an employer yourself, and then you'll get an email as to how to get your appointment for the vaccine.
And Governor, what information do you have so far about how much money can you expect to come to Connecticut for renter relief, and what strings or eligibility rules will attach to that money?
I think it's going to be about $250 million. So that's real money, on top of some of which we've allocated for the CARES Act. As you know, the Department of Housing is still providing the CARES Act money as we negotiate with tenants and landlords. We'll be ready to go when the federal funding comes. It's probably going to take could take a few weeks. And I don't know what the strings attached on that are as yet, Maz.
Yeah, I'll add to that, Governor. As you know, the federal agencies will not start providing guidance until the final bill is actually signed into law. So that goes along with what the governor was saying, the importance of the fact that this was a bipartisanly negotiated bill, and the states are ready to get that guidance so we can start moving fast and get our structures in place to be able to get funding out the door once it becomes available to us. So we have many members of our team. We've already have our strike force put together, led by our Washington, D.C. Director, Dan DeSimone. But one thing that we need to happen is the president needs to make a decision on if he's going to sign this bill and let these agencies provide guidance to the states so we can get to work.
Thank you all.
Thanks, Paz. I'm getting the signal here. Let me just say, on behalf of Deirdre and Josh and Paul and myself, it's been a heck of a year, hasn't it? And we wish you obviously all the very best for Christmas and this holiday season. And I'd just like to especially say to all the members of the press, we've been here a long time together, and thank you for responsible journalism and getting the information out. We're trying to get the information out as best we can from the scientific community, lead with health. There are a lot of rumors out there, and what you do is an invaluable service. So I thank you so much for what you're able to do this complicated year. And man, I'm ready for 2021. Take care, everybody.